Hi guys, this is David Villar and welcome to this next video on toxicants that affect the GI tract. On this one we will discuss China berry tree, poison ivy, false acacia and oleander. So the first one is on China berry, a quick description. This is a full grown tree with a rounded crown. The leaves are very long, up to 20 inches, with alternate leaflets that have long petioles, and they are a little bit darker green above on the top and a little bit lighter green below. The flowers have five purple petals growing in clusters, and the fruit is a drupe that is light yellow when they mature, and they gradually become wrinkled and almost white. This is an ornamental tree planted across the US and in many other countries, so it is likely you will find it in parks. The hard seeds are also used in art and crafts, such as making beads for rosaries. The animals can ingest the fruits, but if they do not chew on them, because the flesh surrounding the seed is non-toxic, but if they crush them during the ingestion, the animal will be exposed to the toxins. In fact, birds are able to eat the fruit and spread the seeds in their droppings. Now the toxins are three terpenoids. The first thing of poisoning appears a few hours after the ingestion, and they include a wide range of different signs: loss of appetite, vomiting, constipation or diarrhea, bloody feces, abdominal pain, pulmonary congestion, cardiac arrest, rigidity, lack of coordination, general weakness, blah 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 blah. So as you can see, the signs are not very specific, and death may take place after about 24 hours. Now here is a paper of experimental intoxication by leaves of China berry in cattle. They gave calves of about 250 pounds doses of leaves, starting at 5 grams per kilogram of body weight, all the way up to 30 grams per kilogram. With the lower doses, the signs started at 24 hours, and with the higher doses, they started at 8 to 12 hours. 8 of the 11 animals survived, and 3 of them died after 1 to 2 days of the onset of signs. On this other table, they list the type of clinical signs that were displayed by each animal. With the lower doses, the main signs were apathy and ruminal atony that lasted for about 24 hours. And with the higher doses, in those animals that died, the signs were also the same: apathy and ruminal atony. But as we just said before, they also displayed more severe signs with dry feces of diarrhea, muscle tremors, incoordination, hypothermia, sternal recumbency, and abdominal pain. Now, there are not many reports in dogs. Here is a couple of them if you want to read more about on the topic. On the top one that was published in Jaffna, 2 dogs became acutely ill following the ingestion of a fallen fruit tree, and the signs developed within hours, and they were characteristic of GI and CNS problems. Neither of the 2 dogs survived more than 36 hours after the onset of signs, in spite of aggressive emergency treatment. In the case below, the outcome was a little bit better, but after they did radiographs, and when they saw those small radiodense bodies in the stomach, they did surgical extraction of all those seeds, and with proper treatment, the patient eventually recovered. Now the next one is in English ivy. You will recognize it right away because it's a very common creeping vine that is used as a ground cover, and you'll find it in climbing on the sides of buildings as any other house plant. The leaves are 3-lobed, and they look like those in maple trees. I had first-hand experience with these plants when I used to have birds in aviaries. One day I thought to introduce pots of English ivy in their cage, and the next day, guess what? There were many birds dead on the floor. So just remember to be careful if you have aviaries and never introduce plants that you don't know whether they are toxic or not. The next one is on false acacia. This is a tree in the bean family. Just like any other plants in the bean family, the leaves are alternate, pinnately compound, with leaflets that are elliptical or oval shape, and they stand opposite in pairs. Now, if you notice, the stems have spikes that resemble large rose thorns, and the fruits are pods that are straight, flat, with many seeds, just like in any other legume. Now, the toxin is similar to ricin. It is a toxoalbumin that inhibits protein synthesis. So the most sensitive cells are those that are rapidly dividing, like in the GI tract. The horse is the most sensitive species, 10 times more so than cattle. And the cases described usually are from tying horses to the trees, and the animals start stripping off the bark of the tree. It could also happen when they chew on fence posts that are made from this rot-resistant wood, and they will usually not be tempted to eat the parts of the plants if they have any other better foods to eat. Now, you will not find many cases reported. Here is one describing 9 horses. Unfortunately, I could not read the abstract because it's in German, but they mentioned that 9 of the 9 horses had no gut sounds. They were colicky from the impaction. In 3 of them, there were CNS signs of somnolence, alternating with phases of excitation and head pressing. And the intestinal inflammation probably caused an increased absorption of ammonia, which is responsible for the CNS effects that we will see in the next case. Now, if there are no CNS signs, the prognosis is favorable with symptomatic care. And in fact, they mentioned that 7 of the 9 horses eventually recovered with symptomatic treatment, but they don't really mention whether the other 2 died or had to be euthanized. Now, here is a case in 2 ponies that showed signs of colic and mild diarrhea shortly after being witnessed eating roots of black locust. They were both treated symptomatically with activated charcoal on day 1. They gave paraffin on day 2 with a nasogastric tube intended to evacuate the toxin from the GI tract. They also gave lactated ringers for 3 days at a maintenance rate. They also gave antibiotics because of the elevated temperature in 1 horse and a potential endocarditis on the second. And they gave psyllium to promote intestinal healing and evacuation of those ingestions. Now, on day 2, one of the horses developed CNS signs of head pressing, circling, and ataxia, and they found that ammonia levels were markedly elevated at 273 micromoles per liter. The normal values are between 11 and 55, so they were 5 times above the normal range. They treated the pony with lactulose to reduce ammonia absorption from the intestinal tract and to enhance the ammonium ion excretion in the feces. And the next day they say that 3 days after the exposure, those CNS signs disappeared and the ammonia levels were back to normal. So in this case, the encephalopathy was caused by high ammonia that was attributed to the GI disease and not to the liver. In fact, those liver enzymes were normal, and in the end, both ponies recovered completely. In the discussion, they mentioned that with small doses, the GI signs are almost exclusively confined to the GI tract, but with higher doses, they will also develop CNS signs. And in this case, the CNS signs of colic and diarrhea preceded the neurological signs also. So as you can see, some plants can cause not only GI signs, but also affect other organs. The next one is oleander that targets the GI tract and the heart. It is going to kill the animal by basically damaging or creating myocardial necrosis. But prior to that, the animal is going to show severe GI signs. This is one of the most toxic plants ever known. Just one leaf is enough to kill a human. The plant is very easy to identify. You will find it in many parks and roadsides. It is an evergreen shrub with simple linear or lance-shaped leaves. They are sharply pointed and they have smooth edges. They have two parallel veins that run perpendicular to the midrib, and the flowers are arranged in clusters that are either purple or white. The toxins are cardioglycosides that are similar in every way as an overdose of digoxin, which, as you know, is a drug that is used to treat congestive cardiac failure. Digoxin has a very short margin of safety, and if you exceed that margin, the dog will develop severe GI signs of vomiting, diarrhea, anorexia, before the arrhythmias that will eventually kill him. The mechanism of action is by inhibiting the sodium-potassium ATPase pump, which, as you know, is necessary to restore the membrane resting potential. If the pump is not working, the potassium will remain outside of the cell, and the serum potassium concentrations may increase up to twofold, causing severe arrhythmias, which can be either on the bradycardic or tachycardic side. The plant is bitter, very unpalatable, so the most common source is always negligent people that are doing some garden trimming, and they throw the plant into a dry lot or wherever the animals stay. The toxins are so potent that even honey made from nectar of oleander blooms can be toxic to humans. Now here is one study in 10 dogs that were experimentally dosed with 0.25 grams per kilogram of ground leaves of oleander. They recorded the clinical signs, the blood pressure, and they did an electrocardiogram at times 0, 4, and 24 hours. This is an excellent study because with 10 animals we can see the range of clinical signs that they will exhibit and which ones are the most common in a group of animals. In this case, no dog died after the ingestion, but they all exhibited severe signs of poisoning. So in all the dogs, vomiting was severe, starting at 27 minutes, and they were sustained for 12 hours. Probably they were just nausea and attempts to vomit after they had emptied their stomach on those first bouts of vomiting. Hypersalivation happened in 8 of the 10 dogs, congested conjunctivitis in 7 of 10, dehydration in 5 of 10, anorexia, abdominal pain and tremors in 3 of 10, and diarrhea in 2, and tenesmus in just 1 animal. Now the good thing about having a group of animals is also shown on the type of the electrocardiogram changes. All of them resolved without any antiarrhythmic treatment, but if they had received a higher dose, they could have easily killed those dogs. 4 out of 10 dogs presented a sinus bradycardia. 2 of 10 had second-grade blockage. 2 of 10 had premature ventricular complexes, and one of them had sinusal tachycardia, and one of them had paracystic ventricular tachycardia. Now the beauty about having 10 dogs is that not all of them will develop bradyarrhythmia, which is the most typical presentation with an overdose of digoxin. Basically the vagal tone is increased, and that results in a parasympathetic overdrive that tends to cause a bradycardia and lowers blood pressure. But as you can see, not all the dogs behave as expected, so atropine would not be the antidote for all the animals. So the take-home message from this finding is that you always treat the patient and not the poison. In fact, not all animals presented the same clinical signs. The fact that not all animals presented more of the clinical signs that are listed here was likely because the dose given was not high enough. On this table, they show the results of the blood pressure at 0, 4, and 24 hours. At 4 and 24 hours, the mean systolic pressure showed a state of hypotension, which returned to normal after at 48 hours. This is even more important than the arrhythmias because lowering blood pressure will kill the animal in no time. The low systolic pressure was somewhat compensated by an elevation of diastolic pressure. And as I say, all the dogs managed to get over the problem, and without treatment, they returned to normal after 48 hours. Oleander poisoning has been described in almost all species. This paper describes 6 cases in 6 cattle farms, usually by negligence of the farmer, trimming those bushes and throwing them to the cattle to eat. And there were 92 cattle in total, but as we see, of those 92, 57 animals ended up dying. In one of the cases, there was a total of 31 animals, and 28 of them died. So this study really is not great because they lack a good description of the clinical signs. They didn't do any post-mortem examinations either. And as I just said earlier, if one leaf is enough to kill a human, probably not many more will kill a horse or a cow. Now, the more characteristic lesions take place in the heart. What we see here is the left ventricle of the heart of a horse with an oleander toxicosis. The top image shows that the subendocardium is thickened by edema and hemorrhage, which extends into the underlying myocardium. Between the endocardium and the myocardium, there is Purkinje cells, which is marked with the letter P. On the bottom, we can tell the difference between healthy myocytes in the right and those that are fragmented and necrotic that are pointed with the arrows. Now here is a paper in 30 horses diagnosed with oleander poisoning. 15 of those 30 end up dying in spite of treatment. This happened at the University of California. They mentioned that 3 of them died on the way to the hospital. And the finding upon arrival to the hospital were mostly GI tract signs, ileus in 19 of 27, colic in 12 of 27, diarrhea in 6 of 27, abdominal distension in 2 of 27. They also noticed decreased tissue perfusion in 16 of 27 animals. And the way they did this is by looking at the peripheral pulses that were weak. They had prolonged capillary refill time, and they had hyperemic injected mucous membranes. Now, they estimated the duration of clinical signs prior to referral with a mean of 43 hours, but that varied a lot, as we can see by the standard deviation. In 18 of 27 horses, there were cardiac arrhythmias that were detected by auscultation. And when they did an electrocardiogram, they found that most dogs had ventricular tachycardia. So we can see in horses, it is more common to have tachyarrhythmias than bradyarrhythmias that we mention in dogs. A high PCV was found in 16 of 27 animals, and azotemia was found in 19 of those 27 horses, and that was also a poor prognosis or outcome. The treatment was focused to treat the patient, not the poison, and that's why we see such a long list of differential interventions here. I'm not going to go in detail in all of them, but I will highlight the most common ones. Fluids were given to all the animals. This is important to maintain blood pressure and try to reverse the azotemia that was present in most animals. If they were not successful restoring blood pressure, they probably gave colloids, plasma or hypertonic solutions. And the horses with the arrhythmias had obviously the worst prognosis. So they gave lidocaine, which is the treatment of choice for tachyarrhythmias. For the colic, they gave Banamine as the analgesic of choice. They decontaminated with activated charcoal in 10 horses. But as you can see, the mortality was very high in spite of all these therapeutic interventions. Now, to end the presentation, here is a cousin of Nerium oleander. It's commonly known as yellow oleander. It's a very small tree. It's kind of a small tree, and as you can see, the flowers are yellow and trumpet looking. The leaves are linear and not as wide as those in Nerium oleander, but the toxicity is just like we saw for oleander. In Mexico, they call this plant cat's testicles tree. I guess someone saw the resemblance with the balls of a cat. Obviously, this is not a very botanical way to describe any plant, but it's kind of a way to not forget about it. So this is the final slide, guys. I'll see you on the next video, so take good care, and until next one, bye-bye for now.